Okay, so if you guys go to your MBLEX basics document, which is in your MBLEX Google Drive, if you go to your MBLEX basics document under hypothalamus and pituitary, you have this summary here. All right, it's short, but it's, I believe, all the information that you need to know for the hypothalamus and the pituitary and for most of the hormones. So you can go over that. Now, pathology and medications. Yeah, and we're going to get into a little bit of referred pain today. Okay, because that is a section on the pathology module. All right, let me just double check that I'm recording. Yes. So this section is called Pathology Contraindications, Areas of Caution and Special Populations. This section addresses the important implications of pathological changes in the body. So pathological means diseased or disease generating. Protecting the client from harm and knowing how and when not to treat are essential for safe practice. So think about, let that sink in for a minute. As a massage therapist, you have a practice where you treat people. And many of the people who you treat are not well. Some of them are athletes who are in tip-top shape, and some of them are, just chilling, and some of them are not well. And that can mean cardiovascular disease, which is the #1 condition in the United States, all the way down to diabetes and everything, all the complications that come with that, which is the #8 condition in the United States. You have to protect the client from harm. That means the harm that massage can do to someone's body. If someone has a circulatory problem or an autoimmune problem that affects their skin, certain kinds of techniques could do harm by abrasion, by abrading or opening or otherwise harming the skin. If someone has a condition that doesn't allow them to feel, they have maybe some numbness or some loss of sensation, a normal deep massage, which may be too much for some people at some parts of the body, becomes risky because they can't give you the feedback to tell you this feels like it's too much, right? Someone who has osteoporosis, osteopenia, a thinning of the bones, a weakness of the bones, that should be pretty obvious that there are some things that could do harm. So when it comes to the MBLEX and practice, but especially the MBLEX, when you think about pathology and you think about contraindications and cautions, what I want you to think about is, could this technique do harm on this person, right? How do I not do harm? Something is contraindicated when it can do harm. And you can do harm locally for local contraindications, or you can do harm systemically, systemic contraindications, general contraindications. Understanding the ways in which pathological changes affect the body's ability to accept massage or bodywork treatment, and recognizing the signs and symptoms of common pathologies will help the practitioner identify contraindications and understand the best way to proceed when presented with pathological changes in the body. Understanding the way the pathological changes affect the body's ability to accept massage or bodywork treatment. We were just talking about that. Skin, the bones, ability to sense pressure. And here are the specific study points for contraindications. So we have to understand or make clear the differences between local contraindications and systemic contraindications. We have to identify when certain types of treatments are contraindicated. We have to recognize the major contraindications, including fever, acute infections, diseases, and inflammation. Understand site-specific issues like bad bruises, fractures, rheumatoid arthritis, open lesions, acute trauma, and peripheral neuropathy. So we're going to go over all those today. When you hear the word contraindication, think do not massage. Think massage will do harm. Or massage will do more harm than good. A systemic contraindication compared to a local one. Systemic means the whole body system, the whole skin system, the whole circulatory system, the whole respiratory system, the whole skeletal system. Or it can mean the whole body. You can think of it also as the whole body because it's wide enough that you could just think of it as the whole body. Systemic refers to system, and general refers to the body in general. They are considered synonymous. They're considered the same. And systemic means do not massage. Systemic contraindication means do not massage, or only massage with a doctor's approval. Written approval. You have to get everything in writing. Because if something goes wrong, you need to be able to show, look, I went by the doctor's instructions. I went by the book. Local, one small area of the body. So local is just one area. You can massage the client. You can treat the client, but not that part of the body for which there's local contraindication. So an example would be sunburn, a cut, a muscle tear, numbness or loss of feeling in a specific area, a fracture, any kind of open lesion. And then exceptions to the rule of local, where you see something on one area of the body, like the foot or the skin of the arm or the eye, or something to do with the sinuses, for example, right? So one important exception where you see something that looks local, looks like it's localized to one area, is the question, is it contagious? And the answer is yes, or probably, or it might be contagious. If you're not 100% certain that no one else is going to get what this client has or what you have, just cancel the session, just reschedule the session. Don't treat the person at that time. An example would be conjunctivitis. So pink eye. I'm just like pulling something out of the air that, I as a parent have had, I myself have had them, and you see kids with these, right? An example would be conjunctivitis, commonly known as pink eye. There are 3 causes for conjunctivitis. The most common one is like dust, local, just stuff that's in the air. If a person is not used to being in a dusty environment, like maybe there's construction at their office all of a sudden, or they move apartments, or they're, a piece of furniture gets like especially dusty, they don't clean it enough, and then one night they sleep on it, they get more exposure than usual to dust. The dust can accumulate inside of basically the hair follicles where the eyelashes grow, and it's kind of like a pimple, right? But it can be very painful, and that's that's a sty. Conjunctivitis is where the conjunctiva, the white of the eyes, starts to become irritated, and that can come from stuff that's in the air or dust or pollutants. But it also can be viral, or it can be bacterial. The bacterial moves really quickly, and it's really, really gnarly looking. The viral can move a little bit more slowly and is less gnarly looking, but both of those are contagious. So if someone says, I got something with my eye, and you're looking at the eye and you're going, I'm seeing like a little bit more like water in this eye than the other one. It's like red in nature. You know what? Don't mess with it. Don't have that person put their face in the cradle and sit in the lobby and go to the bathroom. Just tell them, I can't treat you today. I'm really sorry. And handle them as best as you can. but don't treat people who with things you think may be contagious. Even if the answer is I can't tell, it's better just to be safe than to give it to someone else. There's disagreement in this area, just like there's disagreement in how many body systems there are, or lots of things in medicine, and you are practicing medicine. There's lots of you're not allowed to say medicine legally, but you are practicing medicine. There's disagreement about what is local versus systemic. So DVT is a good example, like a deep vein thrombosis, for example. Is that local? Those usually happen in the leg. Is that local? What about other kinds of thromboses, like where there are blood clots in some blood vessel? Is that local, or is that actually systemic? Well, if it breaks off, it travels. It's systemic for sure. But this is an example of something that you could consider systemic, even though it looks like maybe there's only one small area of the leg that's like painful, swollen, perhaps red. Still, it is systemic because the entire system is being affected. So you have to know, I think, less than half a dozen examples of things that have these local, like small signs, but actually they're systemic, and you just need to get a doctor's approval. If someone says they have a deep vein thrombosis, or you suspect a deep vein thrombosis, just tell them, I'm going to refer you. I need to refer you back to your medical doctor, your primary care physician, and just go get that examined and have them clear you for massage. It's better if you get something written. Please get something written from them, and bring it back, and we'll start working together. And probably they will say, but if they don't work on the area that's affected. So the area that's affected is definitely local, but the client is coming in with a systemic contraindication. Another one is edema, like local swelling. So you may have edema, a person may have edema in the extremities, in the hands or in the feet, the ankles. But edema is a sign of something else: poor venous return, challenged lymphatic return, high blood pressure, weakened cardiovascular system. So, what is causing the edema? There's something else happening. Are the kidneys working insufficiently? Is there an endocrine problem that doesn't permit the kidneys to pull water out of the blood? Like, there is something systemic happening with that individual. Always think, is it safe for the patient to receive massage? Or am I going to do harm? Will massage do harm? Is it possible that I could do harm? In general, if there is a systemic contraindication, just so you're clear, it's a complete contraindication. You shouldn't touch that person. You can't massage the person. Don't even touch them. Because without a doctor's approval, there's no way for you to know whether or not, there's no way for you to gauge the risk. Systemic, like I said, can mean general. You can consider that to mean general. Systemic refers to system-wide, the entire body system: cardiovascular system, senses, immune system, skin, respiratory system. But potentially, it could be the whole body that's affected. Some examples where the whole body or multiple systems can be affected are fever. For sure, it's a systemic contraindication. The person has a fever, they probably have something contagious. If not, their body is so busy right now, fighting something, fixing something, healing from something, that acupuncture, in my case, acupuncture, but definitely massage, would be too much of a challenge, too much of a drain. Anything that we do to the body, it causes an amount of like controlled damage, controlled trauma. Think about some of the things that we do for sports injuries or for chronic injuries. We're literally tearing the body apart sometimes, and other times just like gently flushing the body out. Still, there's some damage being done to the skin that has to be repaired just by virtue of the hand being on someone. So there's a metabolic cost. There's the cost of repairing for all physical medicine modalities, acupuncture, massage, chiropractic, some types of physiotherapy, which refers to physical therapy and manual therapy combined, right? Where they manipulate joints and soft tissues using their hands or using tools. And they also have people move, physiotherapy. Anyway, all right, contagious diseases. Anytime someone has a virus or a bacteria, that includes you. 70% of Americans, that's the overwhelming majority of Americans, go to work when they have cold symptoms. Oh, it's just cold, it's no big deal. Nobody ever dies from cold. Not true. If someone is immune compromised, if if someone has even a moderate pulmonary condition, if they have some kind of like severe pulmonary condition, like where they need a lung replacement every 3-4 years, which I know people like that, then it is not safe for them to be around you at all. What about a child whose health picture has not been made clear, but seems to react strongly to their environment? Breathing may be a problem for them. In a case like that, there's too many unknowns. The best thing, I think, the best guidance that you can use if you have a cold is to be really, really super honest with yourself and ask, do I think I'm contagious right now? And you just go to the web and look up, okay, how long, contagious, cold symptoms and contagious, and try to educate yourself on that. But there are different lengths of time, different days after the onset of symptoms. If symptoms are active, that usually points to being more contagious than not contagious. The more time between the onset of symptoms, the more time goes by, the less contagious someone will be. You can have lingering symptoms and not be contagious. But if it's the first week of having cold symptoms and you're for sure this is a cold and like not allergies, or you're for sure this is not allergies, don't go to work. Don't go to work. It sucks. Our society does not support us in this. It really doesn't. And people in the healing professions, we're oftentimes self-employed or sole proprietors or contractors. We have even less protection if we get sick. We straight up don't get paid and sometimes don't get called back. But it's totally unethical, totally immoral to go to work when you have not asked yourself the question, am I contagious? And your clients are going to come in too, because that's how everybody rolls in America. We're like, we got to do this, get this done, make this dollar. And, I got a cold, but I'm not dying, so nobody else is going to die. Well, at least on the NBLEX, it could do harm. All right. COVID, flus, colds, no matter how mild. This is not me saying this, no matter how mild. This is where was this from? Some like medical website, some medical association website, like the AMA or something like that. All right. Other examples that people may or may not think about: strep throat. We know it's highly contagious, but sometimes people don't think about it, and people do get like this low-level colony strep, like chronic strep. You just ask the question. I mean, are you on antibiotics? Does your doctor say it's contagious? My kid had strep for a year on and off. In those periods of time, we had to just verify that he wasn't contagious, so we knew when to keep him home and when not to. Tuberculosis may not sound like it happens very often, but people are exposed to TB all the time. Especially, I know some of you are in states where there's a large influx of immigrants on a regular basis. I am too. So we get, even though we may have tuberculosis shots from an early age, that doesn't always happen in all countries. Even though we have abundant access to medication, not going to get into the whole managed care, keeping medication away from us discussion right now, but in other countries, a lot of times they don't have adequate access to antibiotics to control tuberculosis all the way to the end of a treatment like they need, and then it starts to proliferate. So TB can be an issue. If you work in the public schools, if you have anything to do like working in the state government, they will probably ask you to take a tuberculosis test or to document, that you had a tuberculosis test. Shingles, chickenpox. Well, if you get shingles or chickenpox, you're not going to feel like going to work. But people can have pretty high pain tolerance. So if someone has shingles, they may be in a little bit of pain, but they might be the kind who goes to work and then goes to get their weekly or their monthly massage afterwards. So those are really contagious, really contagious. Conjunctivitis, which I mentioned earlier. Okay, other systemic conditions: kidney failure, kidney conditions, liver conditions, or liver failure. You might look at that and say, well, of course I'm not going to treat somebody who's suffering from kidney or liver failure. But for the purposes of the NBLEX, you have to keep this in mind, that kidney failure, kidney conditions, liver failure, they're a total contraindication. Hypertension that's untreated, with untreated is the operative word, is the important word. On the NBLEX, you have to read every word and you have to consider the context and the specifics. So here we have, in the context of how we may do harm using massage, we have a specific thing: untreated hypertension. It just is like, becomes anybody's guess whether or not it's safe, whether or not you're going to harm the person, right? So again, refer the person to a medical doctor. Go get checked out by a doctor. Start treating your hypertension. Come back. I'm happy to work with you once that's once you know what is happening with your blood pressure and it's being managed. Under the influence of drugs or alcohol, including medications. Many times I've had people come in and someone has changed, a psychiatrist or a medical doctor has changed the dose of an antipsychotic or an anxiolytic, and the person is like really out of it, or they're trying a new supplement, like melatonin is a popular one. And they just started taking it, and it's like really, really making them drowsy, really keeping them from being alert. Might be a good idea to send the melatonin person home. Definitely a good idea to not treat a person whose medication has been adjusted, and they're obviously like telling you that they're more fatigued and less aware. Definitely not a good idea. Also consider, how are they going to get home? Do you want to let a person leave your office who is less aware and drive a car? Offer to call someone. Hey, are you sure you're okay to drive? You sure you're not a risk to anybody else? Do you want me to call somebody for you? Or can I call you a cab? That's not always possible in every area, but at least if you do that part of your diligence, at least you have tried. Right? You've tried to prevent harm to others. Okay, again, the question of a DVT, is it local or systemic? And here I'm just specifying that the cardiovascular system is affected, not just one leg, plus the risk is system-wide. Here's some local contraindications. We have two columns here. One is advice on how you can mentally organize things, and the other is just a collection. So in the first column, I want you to recall or remember that local contraindications means one area. It's not the whole body, not general, not systemic. Local is anything that needs to be left alone in order to heal. Like if you massage it, if you apply some oil, if you use heat or cryotherapy, it will slow down the healing, because it will make the metabolic activity slower, or it may do more damage. It may open things up, or it may irritate things, or it may give the body more to deal with than metabolically it can handle at the moment. Any kind of open skin, for sure. Cuts and scrapes, lesions, which you see in diabetes, see those also in shingles. Any kind of surgical wound, someone has stitches, liquid stitches, anything, bandages, burns, including sunburn, right? Non-healing sores or necrosis. So I bring up non-healing sores and necrosis because as alternative medicine providers, people will come to us saying, I have this thing that I have this sore, this like open area, and it hasn't been diagnosed. I haven't seen a doctor for it, or I saw a doctor for it and they don't know what it is, and I've chosen not to get it treated. And with something like that, you absolutely have to stay away from it, and you should refer them to their medical doctor. Just make sure that they've seen a medical doctor. Okay, so skin damage, any kind of skin damage that includes sunburn or frostbite, any kind of burn, including steam burns. It may not look like the skin is compromised with a steam burn, but it is for sure. And then other things that are local contraindications would be an aneurysm, varicose veins, phlebitis. Those are all circulatory issues, right? But they're in one small area, so you have to stay away from those. With each one of these, you should have gotten a doctor's approval, right? Because they are also systemic in addition to local. Neuropathy itself is local. However, neuropathy is seen oftentimes in diabetics or people who have some kind of so-called nerve root lesion. I hate that term because a lesion is something that grows, and I think a lesion is something that grows. But what Western medicine means when they say lesion, when they say nerve root lesion, is something that is interrupting the function of the nerve at the root of the nerve. So along the spine, just outside the spine, or maybe inside the vertebral column, a nerve root lesion could be something like a disc that's worn down and now two vertebrae are pressing together, swelling in an area that causes more compression, because swelling is water. It's a mass of something, right? So it can cause compression. Could be muscles that have gotten tight or even started to calcify and become stiff. It could be tears, might be bone spurs. People get bone spurs in their vertebrae. We probably all have them. So neuropathy can be caused by a lot of things. There are a lot of things, therefore, behind neuropathy, but it is a local contraindication, neuropathy, and you do need to ask, well, what is causing it, and is that being managed by a doctor? If the answer is something like diabetes or cardiovascular, some kind of cardiovascular disease, then you need a doctor's approval. Muscle tears, bruising, don't massage a muscle that's torn. Don't mess with the tendon of a muscle that's torn. Don't take a patient through range of motion using a muscle that's torn. Common tear that I can show easily without getting out of my chair is a biceps tear. People do tear their biceps doing strength training. And if you move the shoulder, right, because the bicep, in part, it does flexion of the shoulder. It's a synergist for shoulder flexion, but it also does its main, as a prime mover, it flexes the elbow. If you move the elbow, lengthening and shortening the muscle, that can worsen a tear. It can increase a tear. So that's the idea with muscle tears. With bruising is a tricky one because if you know what you're doing, you can help to disperse the blood of a bruise. It may not look like it, but if you do some very, very gentle flushing above and below a bruise, that can increase the circulation gently enough, gradually enough, and that'll last several hours, maybe even a day. So the body will be circulating that stuck blood out of there and bringing fresh blood in, which brings a whole repair mechanism. So bruising, it's for the MBLEX, it's a contraindication, but in real life, you have to use your experience, and make sure that you don't experiment. If you've never worked on a bruise, if you've never worked on a contusion, don't make this person your first time. Go read, watch videos, ask colleagues in reverse order. Ask colleagues, do some reading, watch videos. Fractures, you can't put any kind of pressure on or around the bone that's a fracture. And that's like if the fracture is in a limb, I would stay away from the limb entirely. Because what if they have a fracture, for example, in the radius or the ulna, and you move the wrist? That still can move or vibrate the radius and ulna. At the very least, that could cause pain, right? Or you move the elbow, or you move the shoulder, and in the process of moving the shoulder, you stabilize holding forearm. Just stay away from that limb. Work on the other limb, work on the center of the body. Pregnancy. Pregnancy for sure is a local contraindication. You have to you have to think also about the trimester, and that requires some special training. And I hope you guys will get that special training, because there are some things that you as massage therapists can do that very few other people can do. And I've had two partners who have been massage recipients, one of whom was a licensed massage therapist. And I've done body work or massage for 20 years in the form of Tuena and Shiatsu. And in Tuena, much like the training you get, we treat a lot of different conditions. And one of them is pregnancy, prenatal, and then postpartum. And we also can work on in a labor context. We can work on people who are laboring, who are delivering the baby. So it is a specialized area, and you guys can do things that like very few other people can do. Just one example is a form of massage. I forget what it's called, but you can manipulate the uterus itself. So before someone gets pregnant, the uterus, it's supposed to be kind of upright and neutral, right? So we're looking at the uterus from the front, right? But there are individuals who have a uterus that is side flexed, right? Or a uterus which is retroflexed, right? So literally the top part of the uterus bends backwards, like the fundus of the uterus bends backwards, right? It's very common, retroflexed or antiflexed. And when a fetus starts to grow inside of a uterus that has an irregular shape, it can cause tremendous pain. And that's something that massage, like manual work, can actually start to correct. I don't know if it'll stay there. I don't think you put the uterus back and then that's it for life. I think you have to be persistent with it. But preparing the body for delivery, I could go on and on and on and on and on. But you guys should absolutely get some training in prenatal and postpartum. And then any kind of like severe depression and anxiety. I've seen that after miscarriages. My ex worked on many people who had miscarriages or life-threatening experiences, near death experiences, like car crashes and stuff. And after all the physical stuff has been cleared out and the doctors and the physiotherapists say, okay, we've done all for you, we can, still there is mental and emotional trauma. And do not underestimate, like always hold up your ability to use touch and your presence with another person to help that person to be vulnerable and trust other people and take a step towards feeling safe. That is one of the effects on the nervous system that massage does. And you will see questions like that on the MBLEX about, what is it people get out of massage, and one of the things that they get is trusting another individual, community. Okay, so undiagnosed lumps or bumps, definitely want to have someone check those out. Definitely don't touch. Undiagnosed pain, that's really a gray area for us. The more experience you get, the clearer it's going to be to you. You will get plenty of people who are going to come in with pain that they haven't seen a doctor for. But some types of pain are more indicative of an underlying problem or an organ problem or a systemic problem than others. And you'll start to get to know those with experience. For the purposes of the MBLEX, just any undiagnosed pain, if they say the pain is undiagnosed, it's a local contraindication. It's a local contraindication. Inflammation, including arthritis, dig that. I mean, you're not supposed to work on areas that are inflamed, where like the joints are breaking down. Well, you definitely have to know what you're doing. Like maybe even using something like a Reiki type approach where you don't touch, but you can flush those tissues. And once you understand how to do that without moving bones, without causing harm, it can be useful. But on the MBLEX, any inflammation, including arthritis, don't touch. And then rheumatoid arthritis, if someone has RA in one area of their body or areas of their body, those are off limits for the MBLEX. And, you know, in real life, you do have to be careful. If you ever feel someone's joints that have rheumatoid arthritis, it's like they're made of sand. You know, they do have the feeling that they can be damaged. They can be ground down very easily. So you have to be very careful. Get all the continuing education you can. Get all the hands-on continuing education you can. Become like the most skilled therapist that you can be. Massage therapy is really like in our common awareness in America. Massage therapy is, you know, it's about like, it would be an understatement to say that it's undervalued, that it's disrespected. The potential of manual medicine is only limited by your knowledge base and your experience base. So go get the experience, go get the knowledge. It's really incredible what you're embarking on. Okay, you should definitely get medical clearance, doctor's written approval for any kind of cardiovascular condition, a thrombosis, deep vein thrombosis, phlebitis. Phlebitis is inflammation of the veins of any kind of blood vessel. Sometimes you can see it. You can see blood vessels that are red, swollen. If you're not sure, look at the other side, right? Looks like there may be some swelling here. Can I see your left hand as well, your right hand? And you look at them. What's the difference in contour? What's the difference in color? What's the difference in shape? Some hypertension, some types of hypertension, especially undiagnosed or untreated, and then heart conditions. So, okay, let's just move on. I think I'm talking too much. Any condition already being treated by a medical practitioner. So if they are undergoing treatment or a disease is being managed already by a doctor, you need to get that doctor's written approval to work on this person. Edema definitely needs a doctor's assessment. Definitely needs to be assessed by a doctor. What's causing it is it's safe to work on this person, and you need written approval. Osteoporosis is where the bones, osteo refers to bone. Porosis, I believe, means porous. So this is where calcium is not deposited into the bones adequately, and over the time the bones become porous, they become fragile. So yeah, osteoporosis, you definitely need a doctor's written approval, and that's also something you should have special training in my opinion. How you treat someone whose bones are fragile. Cancer, for sure. Also, once you have a doctor's written approval, it's a local contraindication. Don't touch the area where the tumor is or suspected. Heart problems, angina, anyone with a pacemaker, get a doctor's written approval. Epilepsy, get a doctor's approval. I've had more than one friend who had epilepsy and managed it through herbal medicine and never saw a doctor or didn't have health insurance. And, you know, back in like the 90s or 2000s, not having health insurance back then was kind of a bigger deal than it is now. Just because now I think Medicaid is a little bit more accessible to people, and we're aware of those things now. Also, there are more community clinics now than there were back then. That I might be mistaken about that, but I swear there's more access to healthcare now than there used to be. Okay, and then diabetes. You know, some of these conditions like epilepsy and diabetes, people have them, they know that they have them, and as crazy as it sounds, they don't always get them managed, right? They don't always get them treated. So make sure that you have a doctor's written approval. Remember, you're functioning in a professional context, so you have to think not only about how you may do harm, but also about the impact or the ramifications for you and everybody around you in your professional realm. If you are a business person, whether you like it or not, so you have to think in terms of liability as well. Like, could this person, if I do harm to this person, could that come back to me and damage my ability to practice, my ability to stay open? Could it cost me a ton of money? You know, you don't want to put those things first, but it'll help you, at least on the MBLEX, to think about those things. Okay, now we're going to look at, oh wait, where's the medications? Apparently I separated the medications, so let me go find those. Medications. Okay, so we're going to go back and forth between these. So the pathology includes all the local and systemic contraindications, and then a summary of different kinds of pain, acute versus chronic. There's only 3 more slides, so let's finish pathology and then go to medications. Okay, so we're going to work on, we're going to look at common musculoskeletal conditions, so strains versus sprains versus trigger points, because they are going to ask you about the description of a trigger point. What is a strain versus a sprain? What's dangerous in terms of range of motion? How might you do harm? Understanding various types of pain, like differentiating between acute pain, chronic pain, visceral, and somatic. And then like common conditions and disorders of the nervous system, like Parkinson's disease, some of this other stuff like diabetes. We're going to look at that with in the medications lecture. So sprains, strains, and trigger points. A strain is a partial tearing of a muscle or a tendon. Tendons are attached to muscles. They attach muscles to the bone. So a muscle or a tendon is a strain, a muscle strain. A sprain, on the other hand, is partial tearing of ligament or a joint capsule. So sprain is the joint. I should put joint like that. All right. And strain is muscle. So when you hear sprain with a P, you think joint. When you hear strain with a T, you think muscle. So with a joint, you do get soft tissue tearing, but it's of ligaments, which hold bones together, or of joint capsules. Joint capsules are deeper than ligaments, right? They're the first thing around the outside of the joint. And then you have ligaments, and between them, sometimes you have things like, then you have ligaments, and then you have tendons, and between the tendons and the joint, sometimes you have things like bursa. And there can be menisci, there can be synovial linings inside the joint. Often there's subluxation of a bone. So this is not a term you will get on the MBLEX, but subluxation, I mean, they might put it there in a question, but they're not going to ask you to differentiate, I don't think. But subluxation means the movement of a bone partially out of alignment, not so much that it's out of place. It's like a mild dislocation. It's not a dislocation. A dislocation is a luxation. Luxation. Subluxation is where a bone moves a little bit out of place. This happens, subluxation happens to everybody. You have subluxations in your body right now, so do I. Okay, trigger points. A trigger point, think locus, think muscle, think hyperirritable. Hyperirritable locus within skeletal muscle. So a trigger point can refer pain in specific patterns. You can discern a trigger point by pressing the trigger point in the muscle sometimes. That may or may not reproduce the referred pain pattern, right? So when you hear trigger point on the MBLEX, think hyperirritable locus within skeletal muscle. Any questions about sprains, strains, trigger points, or local or systemic contraindications? Is anything unclear to you guys? All right, so here's an excerpt from Janet Travell's Trigger Point Therapy Manual. If you don't know Janet Travell, you really should check out Janet Travell. The books are pretty amazing. if you like to read and collect information and like do deeper dives into things to really understand them, if you do well with that, these books are a must for you. Otherwise, you can get like a chart. You could probably just get a PDF version of the chart, and you can just quickly look at which muscles refer pain in which patterns, and it will be so helpful to your practice. As an acupuncturist, trigger point needling or trying to release trigger points is one of the most successful things that I do, both in terms of like client satisfaction and therefore the money that I make, but especially in terms of relieving symptoms, So here are various trigger points denoted by an X. And then the red stippling is the referral pattern that those muscles create. So splenius cervicis and splenius capitis, those are muscles that we looked at. They have trigger points up around the area of C2 or down around C6. And those trigger points refer pain into very far away areas. Splenius capitis refers pain up to the vertex of the head. And splenius cervicis refers pain to the corner of the eye and over the ear. Going further up over the ear are other muscles like the temporalis muscle, the upper trapezius, particularly the forward or anterior portion of the fibers. So these fibers here, rather than the bulk of the belly back here, the forward, like where it twists, the forward aspect of the fibers refer pain up over the head, along the eye. There's other trigger points in the trapezius further back into the belly, which refer pain up toward the front of the head. The SCM, the sternocleidomastoid, is notorious for this. Both branches, the sternal branch, the one that attaches to the sternum, sternocleidomastoid goes from the mastoid process, and then one branch attaches to the sternum right there, and then another branch attaches to the clavicle, which is right back here. This branch attaches to the clavicle. So you have the sternum and clavicle and mastoid. And all throughout both of these muscle bellies, these two muscle bellies, there's like 3 or 4 trigger points that can refer pain up to the back of the head, over the ear, into the front of the head, above the eye, around the eye, and forehead. It's really crazy. And you are definitely going to run into all of these down here. You're going to see every one of these trigger points. You're going to see trigger points in the spinal erector group, the gluteus maximus, the gluteus medius, glute min. You're going to see them in the psoas. You're going to see back pain that looks like this. Pain on one side of the spine. Doesn't always have to go up this high, but you're definitely going to see one-sided back pain that is caused by psoas and iliopsoas trigger points for sure. You're going to see them for sure. How do you get into the psoas? Oh man, got to press through the abdomen, through the abdominal wall. It's painful, but people will be really grateful if you can learn to massage the psoas muscle, to press and release the psoas muscle. It'll really help. Okay, pain, acute, chronic, visceral, somatic. So I'm sorry, any questions about trigger point referral patterns? Trigger points or trigger point referral patterns? Remember, a trigger point can be in a muscle, but the pain can be somewhere else. So pain that is caused by a muscle, not in the area where someone is feeling the pain. Pain in an area which is being caused by a muscle in another area. That's a trigger point. Acute pain. Acute pain happens suddenly, starts out sharp or intense, and serves as a warning sign of disease or threat to the body. It's caused by injuries, can be caused by injuries, can be caused by surgeries, illnesses, trauma, or painful medical procedures. It generally lasts from a few minutes to less than 6 months, from a few minutes to less than 6 months. If it goes more than 6 months, it's definitely considered chronic pain by everyone. Some people will say that chronic pain is actually more than 3 months. So there's another place where there's not consensus, and if you click on this, you can look at the study that I took this quote from for acute pain. Okay, chronic pain. There are different opinions on what qualifies as chronic pain. Just keep these in mind. For the most part, the consensus is pretty good. More than 3 months, that's kind of a good, like, moderate definition of chronic pain, although you will find people who say, no, it's not chronic pain until it's 6 months long. Chronic pain is long-standing pain. People have had it for a long time. If it's chronic, they've had it for a long time. It's pain that persists beyond the usual recovery period of a disease or an injury or a condition. It occurs with a chronic health condition sometimes, like arthritis. Chronic pain may be on and off. It may affect people to the point that they cannot work, they cannot eat properly, they cannot sleep enough, they can't take part in a physical activity, they cannot enjoy life. Any relief from chronic pain. Imagine somebody is suffering and they can't enjoy life, and they come to you, they pay you X amount of dollars, and then they lay down and they chill and you go to work. Imagine that person gets like a day of relief where the pain goes from a 9 out of 10 down to like a 3 out of 10. And it's like the day that their grandkids are coming over, or the day that the dad has his children or whatever, right? Or the day that the person has an audition or trying to get a job or whatever, right? Can be pretty significant what you do, can be pretty significant. Even if it's just like a couple hours of relief. Someone who's terminal, who's bedridden, who gets like a few minutes of relief. I know people who have passed who I or someone else work on their swollen legs, swollen feet, and that feeling of pleasure, that feeling of relief in the midst of, leading up to active dying, like that is both unusual and unique and incredibly valuable, incredibly healing. Healing takes place all the way through our life, right up to the end. And you can be part of that. Okay, there are many causes of chronic pain, including injury, illness, and even if a patient recovers, they still can have pain. We're seeing that right now with long COVID. People recover from COVID, but they still have like numbness, tingling, pain sensations. Sometimes they have headaches. And you can see other causes include things like arthritis. Even if someone, even if their arthritis is managed well, rheumatoid arthritis is managed well by medication to prevent flare-ups, still they will have joint pain. Cancer causes a lot of pain. Sometimes no injury or evidence of illness is present. People just have pain and it's undiagnosed. Often you'll see pain that is neurological in origin, so it can be caused by things like multiple sclerosis or diabetes, but sometimes it just looks like a nerve is conducting stimulus, conducting sensory information too easily, right? And they call it neurological or neurogenic pain or whatever. It basically means pain of a nervous or nervous system origin, and that's all the information that they can give. If there's any way for you to help people in that position, that'll be a very serious, a very weighty, a very impactful thing. Sometimes inflammatory conditions like lupus, for example, they cause pain. Inflammation causes a lot of pain. Inflammation can be swelling, right? It can be an overactive immune system. It can be the accumulation of water, and that can cause a whole lot of pain. You see that, you experience that a lot with like flus, where the body is accumulating swelling and not getting rid of it because it's busy dealing with other more important things like an infection, and it causes a lot of achiness. The terrible triad. Wow, this is bad. A lot of people have been through this, including me. So if pain affects your sleep, everything else becomes more difficult. It affects your mood, which then actually worsens the pain or worsens someone's experience of pain. Remember, not all disabilities are visible. Someone feeling pain who is exhausted, that can be disability level interference. The terrible triad. Okay. Any questions about acute pain, chronic pain, visceral pain versus somatic pain? Oh, I didn't define these for you. So visceral pain means pain that's caused by the organs. Let's take a look at the chart for visceral pain. Viscera means organs. This is a very well-known, like famous chart. You see this on in some doctor's offices. Did anybody have this in their massage program? So you can see, for example, that some pain referral patterns totally make sense, like the appendix. The appendix is right there, urinary bladder, the ureter right there, the colon, the ovaries, small intestine. Looks like they omitted the uterus. Interesting choice. Okay. They also omitted the penis and the genitals. You will see people with penis pain or with testicular pain and uterine pain, uterine fibroids. That should be on this chart. Okay, anyhow, pancreas, right over the pancreas, right in the area of the pancreas. Liver and gallbladder, that can go all the way over here to the side where the liver is. Liver and gallbladder for sure. Stomach, more in the middle of the body. Yeah, heart kind of makes sense. And now we start to see with the heart, we start to see a referral pattern down the ulnar side, down the pinky side of the arm into the hand. Start to see a referral pattern. All right, now we start to get into other things that look a little bit less clear to us, right? So on the back, there's a spot on the right. The heart is more on the left than the right, but there's a spot on the right around T4, T5, where you get an area that is painful. If someone has angina, which is the starving of oxygen from the heart muscle, you see referred pain on the back. Liver and gallbladder can look like some kind of back pain or flank area pain. Stomach, you can have mid-thoracic area pain due to the stomach. Then there's a really weird one. Here's the spleen. The spleen refers pain, for some reason, it's only the left shoulder. It refers pain to the tip of the left shoulder. I think the gallbladder might have a referral pattern like that too. The thymus is off center. The thymus gland itself is centered. It's centered right in front of the spine, but for some reason, the pain referral pattern is off center. And then you have the lungs that refer pain or can manifest in pain over the dome of the lung and then slightly up into the neck, or the diaphragm. I'm not sure what problem would affect the diaphragm specifically, but if you look at any of these charts, you will see, yeah, here's another one. Okay, Physiopedia, love Physiopedia. Let's open this so we can get a bigger and clearer view. So liver and gallbladder refer pain into the right shoulder area. The right shoulder area. Missing, absent from this diagram is the spleen that refers pain into the left shoulder. Wait a minute. I think the last chart may have shown it on the left and the right. These are not. I'm not an expert in visceral pain, so this is the left shoulder and this is the left shoulder. This is the left and this is the left. Okay, so that's left side for spleen and right side for liver and gallbladder. Is there anything else unusual? Oh, kidneys. Kidneys can look like back pain down into the sides of the legs, down into the genitals. What else is here? That wasn't on the other one. I think that's it for visceral pain. Okay, visceral pain. So viscera, organs, right? And then somatic pain. Somatic pain refers specifically to pain that comes from the body. So that means the muscles, the bones, the tendons. I'm typing in somatic pain and I'm seeing like all this referred visceral pain. See, it's labeled visceral pain. None of this is somatic pain. All right. What is this somatic referred pain? I'm not going to look at that right now. If you have sympathetic pain, sclerotome pain, that's interesting. If you have pain from a broken bone, that's somatic pain. Pain from a torn muscle, that is somatic pain. pain from some kind of joint sprain, that also is somatic pain. Soma means body, viscera means visceral, or viscera means organs. So somatic is the muscles, the tendons, the bones, the skin, and discrete parts like small parts of the nerves, right? So if someone gets some kind of impact injury, like a fall, if they fall on their arm, or they strike their hand with a hammer or something of that nature, something falls on their foot, they can have nerve pain in their limb from the impact. But that's not referred nerve pain. That's not pain of a neurological origin. It's not just a minute, I promise this will be worth it. It's not let's see, it's not paresthesia, and it's not referred pain from a nerve, like the nerve root or somewhere around the spine. This is a type of pain that I treat all the time, and I'm like intimately familiar with it. It's a term I introduce to clients all the time, and now I'm blanking on it. Okay, I'll find it for you, because I do want you to know it. So any questions about the difference between visceral and somatic? I guarantee they're going to ask you that. The differences between visceral and somatic. We'll take a break soon, okay? All right, and then visceral, somatic, and one thing more that I want you to look at is referred pain along dermatomes or myotomes. So pain that starts due to compression of a nerve root, pain that starts at the root of the nerve along the spine, inside the vertebral column, or just outside the vertebral column. Pain that starts there can travel way far in the body. You will see pain in the thumb and fingers. The thumb and fingers are referred pain from C6 or C7. That's the C6, C7 dermatome. If you follow that up, you get to C. It's not shown here. It's C6 and C7 in the back. The problem is in this area, or maybe in this area. You'll see pain like that. You'll see penis and testicular area pain that's referred by compression around the joints in the sacrum, or the muscles in the around the coccyx, right? So this is S2, S3. And if you go to the chart and go to S2 or S3 and follow those up, you see that S2 is right here and S3 is right here. So S2 and S3 are in proximity to muscles such as the piriformis and the obturator muscles. And all of those are very accessible and not difficult to work on. And you should, if someone says they have penis or testicular pain, you should definitely, you must explore the muscles in the posterior for sure. Which gets into a safety issue, right? Because some people will come for a massage expecting some kind of sexual service, and you're going to have to really consider, or rather, I feel a responsibility to let you know that you have to consider the person who you're working with, their relationship with you, their reputation, and you also have to be very specific about client expectations, about managing expectations in that instance. And feel free to be straight up with someone and just say, if this is referred pain from compression, and if you start to use like these kind of technical medical terms, it'll help establish a boundary for you. If this is referred pain from compression around the nerves in the coccyx, or maybe your piriformis muscle, or some of the other lateral rotator muscles like the piriformis or the obturator are somehow compressing the nerves and referring pain into the genitals, my massage work should help to alleviate some of that. But I want you to know two things. First, this is undiagnosed pain. You're not telling me you've been to a doctor, you haven't had an MRI. I need you to go see a medical doctor and get this checked out. For the MBLEX, you have to get them to see a medical doctor for this. In real life, you have to use your discernment. I need you to have this diagnosed, see a medical doctor. And the second thing I want you to know is that I don't provide any services beyond therapeutic. There's nothing of a sexual nature here. I don't do any of that. Is that clear? Is that something you're looking for? Is that clear? Right. And if you're straight up with people like that, they will, number one, really respect that. They'll know, number two, you don't play. Like, you're not afraid to call things out and just be totally transparent. And these are your boundaries. And if they have referred pain from compression around the sacrum or the lateral rotators, like, I can guarantee that if they're coming to you, it hasn't been fixed. And if you can help alleviate that, you will be like the magna in their mind, right? I mean, you help somebody with that, that's like, you're going to see like rectal pain, vaginal, penis, testicular pain. You're going to see referred pain that people can't treat. I see it all the time. People come in with with pain in their fingers that's caused by compression at their neck, and they say, I went to an acupuncturist and they put needles in the tips of my fingers. You know, it was incredibly painful. Please don't do that this time. Yeah. Okay. I think you guys need a break. So it's 12:04. Are there any questions? Any questions about referred pain, somatic pain, visceral pain, chronic pain, acute pain, trigger points? Okay. You guys take a break. Come back at 12. It's 12:14 now. Please come back at 12:24. Come back at 12:24 Eastern time. Welcome back, everybody. It's pretty interesting. All right, so I just added a couple pieces of information to clarify things. And these are terms that I want you to be really familiar with for the MBLEX. So the term that I was struggling to remember, which is referred pain from a nerve root or from some part of like the nerve pathway, is neuropathy, neuropathy. Pathological means disease state or abnormal. And then neuro refers to nerve. So neuropathy means something abnormal or something problematic. In our case, we're talking about pain from a nerve. So usually when you hear neuropathy, that means compression along the root of the nerve. That can be inside of the inside the central nervous system, or it can be just outside the spine, just outside the vertebral column. Here's a link where you can read more about that to this Physiopedia, article, Physiopedia. This Physiopedia article right here, okay? So that's neuropathy. And please note, there's a difference between pain from a trigger point and pain from neuropathy. Neuropathy is referred pain from a nerve or a nerve root. So on the MBLEX, you definitely should consider that. You definitely should be prepared to answer to answer that there's a difference. And then pain from trigger points is referred pain from trigger points. Dog, come over here. Come back. Come back, dog. Sorry, I just got to get him to keep him from barking. Come back. Come back. Dog, come back. Come back. Inside. 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 Good dog. Good dog. Okay, and then here's the chart on visceral pain, so you guys can take a look at that. We're going to move on from the pain discussion. Are there any questions about any of those? All right, here's a couple examples of questions you might see on the MBLEX. So this is from the AMTA. This is in the pathology AMTA questions file in your MBLEX folder. I think there's 100 questions in here, so most of the pathology questions from the AMTA app are on this slides presentation. Okay, a snowboarder schedules a session with a massage therapist. The therapist notices the snowboarder's knee is red, swollen, and warm, and the client reports it has been painful since he fell yesterday. Based on these symptoms, the therapist can assume the client is experiencing what? Homeostasis, chronic pain, neuropathic pain, or inflammation. And the answer would be snowboarder's knee is red, swollen, and warm. Red, swollen, and warm. Does that sound like neuropathic pain or neuropathy? Does that sound like referred pain from compression at the nerve root? Swollen, warm, red knee. Does it sound like chronic pain? It happens suddenly after snowboarding, so it can't be chronic. Definitely it's inflammation. It's definitely not homeostasis. So the answer is inflammation. And then here's another one, which is if a client's soreness is confined to a specific part of his or her body, it can be described as what? Chronic, systemic, acute, or local? And the answer is local. So it's soreness rather than, we're not talking about like a, what am I saying? Yeah, it's local. Acute has to do with the length of time, local, and systemic have to do with the location. Acute and chronic have to do with the length of time. Okay, let's move on to medications. So for medications, where is our
we did that.
question?
We did that one. We did the medication.
Oh, we did medications already? Okay. So thank you. So then let's go over.
Now I just said I remember that.
Great.
Yeah.
Great. Yes. Thank you, Rosie. Okay, so let's go over some pathology questions. Let's drill some patho questions. Again, the pathology section, I don't know if I told you guys this or not, but in my opinion, the pathology section is the kind of section that you do need to have like lecture material on, which we have just done. We did almost everything in the pathology section in less than 45 minutes. We did the overview of pathologies, contraindications, site-specific pathology related, special populations. We didn't talk about tools yet. Special applications. We didn't talk about areas of caution, special populations, and classes of medications. So classes of medications we talked about last time, right? Special populations would be people who have diabetes versus high blood pressure versus Parkinson's disease. We talked about that last time. So pathology, as long as you have some lecture and then you drill the questions, I think that's the best way to prepare. Compared to kinesiology and anatomy and physiology, you need to have lecture for that, and you need to be working to like actively understand and memorize all the information from those sections, or I should say any information from those sections. benefits and physiological effects of techniques that manipulate soft tissue. Very similar to pathology. You need like one lecture just to introduce you to all the massage techniques, and then you can drill the questions, and you can learn more from the questions than you can from the lecture, because the repetitive nature of seeing the practice questions will prepare you better than seeing it all on, summarized in a chart or on a slide or whatever. But you need the charts and slides to set the background. And then the last three: client assessment, ethics, boundaries, laws, and then guidelines for professional practice. In my opinion, you should do those three from drilling practice questions. So the AMTA app and whatever other apps you like to use. Before we go on, let me stop sharing my screen because I want to show you guys something, and I need to go to my messages to do that. Okay, one of my students from another class, I think it's another class. Start share. Said that this app is really helping her using the ABMP exam coach app. Exam coach. I don't ABMP. I'm not familiar with this app. But if you can get this app, it's helping someone. It's recommended by someone in your shoes. So study guide and test prep, the best MBLEX test prep in massage and body work. Huh. All right. Get ABMP exam coach. Signing up, create your account. It doesn't immediately tell me how much it is. Maybe it costs, maybe it doesn't. Associated Bodywork and Massage Professionals. Do you guys know how much this is?
For my school, it was free. So
Great.
I had that. It was good, but I don't feel like the questions were up to par when I took the test. Like it had good questionings, and it does divide it by body part and like section for, kinesiology and pathology. It was good, but I felt like it was maybe like the middle school or the high school version of the actual tests.
Okay, thank you for that feedback. This individual who recommended this is particularly concerned about their knowledge of muscles. So perhaps the questions fall short, but maybe the info on the muscles might be really excellent. $10 a month for 12 months. I'm definitely going to check this out. Like as a teacher, I definitely have to be aware of stuff out there that's helpful, and also see like where things fall short. So I'm going to check it out for sure.
I think the only good thing that I actually really did like was that they let you retake a bunch of tests. So they had a lot of 100 tests here. It told you when you finish either passing or failing it. It tells you what you had correct and what you had wrong. So you can take it again, and you can pick the subjects that you want to go ahead and take the test on.
Okay, that's definitely helpful. Seeing everything, seeing like the 7 modules laid out and where your percentages are for each one of those is definitely helpful for sure. I think there's other testing sites that have that tell you your percentages. I think Yugo Prep does that. The AMTA app does that. Although, yeah, don't fall into the trap of thinking that taking batteries of questions, taking like collections of questions over and over and over again is going to prepare you for the whole examination. That may be the case for some people, but I haven't found that to be the case for students. The students that I've worked with, we really need our in-depth work on anatomy and physiology and kinesiology, and then a little bit more in depth, and then, touching on pathology, touching on, benefits and physiological effects of techniques. And then the questions like that can be used totally for client assessment, ethics, and guidelines. But I think that most people's preparation falls short because they attempt to use they attempt to use only questions over and over and over and over and over again to prepare for all 7 sections. And the anatomy and the kinesiology are a little bit too in depth for that, I think. You can go over plenty of questions and not understand really the concepts behind them. So, but I think it's definitely worth checking out the app, or perhaps you have someone who has access to the app. But I'm gonna check it out for sure. Okay. So let's go over a few questions. All right. A high school student comes in for a massage and notices he has recently had a cold. Notes he has recently had a cold and currently has a body temperature of 101.5 degrees Fahrenheit. However, he has no other symptoms and says he's feeling much better than he felt yesterday. What is the most appropriate action for the massage therapist? Continue with the massage, but alert the client's physician to his condition. Continue with the massage and take precautions to avoid transmission of the illness. Do not continue with the massage and immediately send the client home, or stop the massage and immediately send the client to urgent care. Which one do you guys think it is? A, B, C, or D?
Third one.
The
C.
third one?
Yeah, send them home.
Yeah, send them home. Yeah. What is poliomyelitis? Is it a viral infection of the nerves that control skeletal muscles, inflammation of the meninges, progressive death of nerve cells, or the rupture of blood vessels? A, B, C, or D? 1, 2, 3, or 4? So which ones do you guys think? Okay, I'm thinking either A or C,
Yeah.
right? Meninges,
Yeah.
yeah, because a viral infection of the nerves to control skeletal muscles is a virus. We know polio is a virus. You may be familiar with polio, that it is a virus. The progressive death of nerve cells does not describe an infection, does not describe a virus. That could be multiple sclerosis. So it is a viral infection of the nerves that control skeletal muscles. Let me just make sure I'm recording. Yeah. Okay, an injury or disorder that causes physical, chemical, or radioactive damage to a person's body is classified as degeneration, infection, trauma, or autoimmunity.
A.
Okay, so degeneration might be an answer if the damage is if the damage is from a disorder internally, right? Disorder internally, but this is an injury or a disorder. So injuries are almost always described as traumatic. Trauma.
Okay.
Yeah. If a person has uneasy feelings that are connected with sympathetic arousal, which psychological state are they experiencing? Schizophrenia, depression, anxiety, or Alzheimer's disease? Uneasy feelings, sympathetic arousal.
Anxiety.
Anxiety, yes. So remember, guys, sympathetic, yes, sympathetic is activated. Also, they give it to you. They say sympathetic arousal. You're aroused. Aroused means alert, awake, looking for danger. Sympathetic arousal, sympathetic versus parasympathetic. Remember, parasympathetic is the rest, digest, comfort, sweet zone. That is like a parachute. Parachute takes you to safety, versus sympathetic. It's no mnemonic for sympathetic. And uneasy feelings, right? Anxiety. A client presents with inflammation and redness that is warm to the touch over a 10-inch region that covers the anterior, lateral, and posterior aspects of her lower leg. That's a big area. Of the following options, what is the most likely cause of these symptoms? Cellulitis, a contusion, a cyst, or a furuncle? So let's eliminate what we can. Cyst and furuncle, those are like skin pathologies, skin diseases, right? It's going to be kind of hard for us to, actually cyst is not skin, but furuncle is. It's a little difficult for us because we don't know about cysts and furuncles, as we haven't covered those in this class. A contusion, we know what a contusion is. That's a bruise. Would you expect a contusion to be inflamed, red, warm to the touch? Yeah, maybe. What about over a 10-inch region on the anterior, the lateral, and the posterior aspects of the lower leg? Would a contusion cover all three surfaces like that?
No,
No.
No. How about a cyst? Would a cyst be 10 inches and cover the front, side, and back of the leg?
no,
What about a furuncle? Would a furuncle cover a 10-inch region? Maybe you don't know, but the answer is no. But you can definitely rule out, you guys answered contusion and cyst. You definitely can rule out contusion and cyst. So the answer is cellulitis. That's inflammation of the subcutaneous tissue just below the skin. It presents with redness and swelling and is associated with a bacterial infection. It's a regional contraindication, which means the therapist should avoid work on the affected area. The client should be referred to a physician for diagnosis and further treatment. A contusion is a bruise. A cyst is a sac filled with benign fluid. A furuncle is a pus-filled cavity that forms as the result of an infected hair follicle. So now we know what a cyst and a furuncle are. You guys had a little trouble with that one. So I'm just going to mark that as red. So you guys can, when you guys go to the presentation, you can go to view, and then you can go to grid view like this. And I think you can actually zoom out like that. And you can just like survey and quickly go through the questions that are marked in a color. These yellow ones I marked because they describe the nature of various kinds of pain. Click on that question, it'll take you right to it. What is a contraindication? A condition for which a massage would be beneficial, a condition for which an approach could be harmful, general relaxation massage for pleasure, a condition in which there is no benefit or harmful indication. A, B, C, or D?
condition for which an approach could be harmful.
Yes,
B.
correct. Yes, correct, B. A massage therapist has been seeing a particular client for several years. When the client is diagnosed with impetigo, how should the therapist proceed? Continue with massage as usual, ensure the client has seen a physician for this condition, and then continue with the massage while avoiding the affected area. Inform the client she cannot have a massage while this condition is present. Ensure the client has seen a physician for this condition, and then continue with the massage as usual.
Inform the client she cannot have a massage while this condition is present.
And why do you think that's the answer, Rosie?
Well, I didn't read the last one.
Okay. Okay. All right. So
But the other one, they're saying that
yes,
basically she hasn't gone to see the doctor about it. So
that is correct. That is correct. Okay. So guys, you got to think, what is impetigo? Does anybody know?
no.
It's a bacterial infection of the skin. It comes from not washing. My 14-year-old son who like knows everything and is smarter than me and is not a hypocrite, got himself severe impetigo because after kickboxing he didn't take a shower, and it's bacterial and has to be treated with fairly aggressive antibiotics. So now you know it is contagious, right? So the question you need to answer is, do you want it in your clinic? Is it like basically, do they need to see a doctor? Should it be in your clinic? Is it local or systemic, right? It's local. Do they need to see a doctor? Yes.
Yes.
Do you want it in your clinic? No way. No way. It is local. Do you want it in your clinic? No. So you're not going to continue with the massage as usual, right? Let's see what the correct answer is. It's ensure the client has seen a physician for this condition. They need to see a doctor, and then continue with the massage while avoiding the affected area. Okay, let's see why. That's not the answer I would have chosen. I would have chosen inform the client she cannot have a massage while the condition is present. So let's clarify. Ensure the client has seen a physician for this condition, and then continue with the massage while avoiding the affected area. Impetigo is highly contagious bacterial affection of the skin, which is most commonly seen in children. While it is important to refer these clients to a physician, continuing with massage can help to enhance circulation and therefore enhance healing. It is also important to avoid treatment in the involved area entirely, as impetigo is highly communicable. Impetigo is a regional or local contraindication, meaning massage may continue as long as the affected area is not treated. Therefore, massage can continue in other areas as long as the patient has also been referred to or treated by a doctor. All right, so there you have it. So again, the options were continue with massage as usual, ensure the client has seen a physician for this condition, and then continue with the massage while avoiding the affected area. Inform the client she cannot have a massage while the condition is present. Ensure the client has seen a physician for this condition, and then continue with the massage as usual. So the AMTA, which is pretty close to the FSMTB, the AMTA's opinion is that the person can have a massage as long as you avoid the affected area. This is a local, not a systemic contraindication, not a general or total contraindication, but they do need to see a physician. If someone came to my clinic with impetigo, I would send them home, but this is not my clinic. This is the MBLEX, right? This is not clinical. This is MBLEX. A client tells a therapist that when she was out for a run last week, oh, you know what? Let me just put that one in red because that also gave us a little bit of trouble. And this is like, we're seeing, this is part of how we learn for the MBLEX. We're seeing it in action now. We're taking like small bits of information about cellulitis and impetigo and all those conditions, and we're learning about them. A client tells a therapist that when she was out for a run last week, she rolled her ankle. She now has pain with walking and swelling in the ankle. How should the therapist proceed? Continue with normal massage, not necessary to refer to a physician. Emphasize treatment on the area, refer to a physician. Avoid the area for now, continue with massage elsewhere, refer to a physician. Instruct patient to go to an urgent care facility. What do you guys think?
See?
Okay, emphasize, yeah, the answer is avoid the area for now, continue with massage elsewhere, and refer to a physician. So emphasize treatment on the area, and that is the opposite of what we should be doing. The reason rolling your ankle or a sprain is a local contraindication is because there may be tearing. Remember that with sprains and strains, that there's often some kind of tearing. A sprain involves the joint and can have tearing of the ligaments or the joint capsules. A strain can have partial tearing of the muscle or partial tearing of the tendon. So in either case, a sprain or a strain, definitely in like the rolling of an ankle, you want to avoid massaging the joint, massaging the area, the ankle itself. Also avoid range of motion for the ankle, the foot, and probably the knee. Also avoid range of motion. So it's avoid the area for now, continue with massage elsewhere, refer to a physician. A client has spina bifida. This is a condition of the spine which developed in utero and has been present since birth. What type of disease is this? Autoimmune, acquired, acute, or congenital? The answer for that one is congenital. What is a hernia? The loss of sensation, little or no muscle tone, muscle pain, or a protrusion of a loop of tissue through an abdominal opening or tear in a muscle wall.
Protrusion of loop of tissue through abdominal.
Correct. D. A massage therapist applies pressure to a specific area of the right upper trapezius. While he does this, the client reports pain with this that radiates along her upper arm. What is the most likely direct origin of these symptoms? Is it radiculopathy, which is the same as neuropathy? Is it radiculopathy? Is it a pinched nerve? Is it hepatitis, or is it a trigger point?
A trigger point.
A trigger point, that's correct. Does everyone agree on that?
It was a tie for me for a trigger point and a pinched nerve.
Okay, so let's get some clarity on what a pinched nerve is. A pinched nerve and radiculopathy are one and the same. Pinched nerve and radiculopathy are one and the same. So if we go to, let me just put that in yellow so you guys can come back to that. But now you know, hopefully you will remember radiculopathy, neuropathy, pinched nerve, those are the same. And I'll put that down in here. I'll put that down in here for you too, okay? What is tendonitis? Inflammation of a tendon sheath, inflammation of a tendon, inflammation of a joint, inflammation of a bursa. Tricky, right? The answer is inflammation of a tendon. Tendonitis is the inflammation of a tendon and tendon muscle junction. Inflammation of the tendon sheath is called tenosynovitis. Tenosynovitis. Sino, I guess, like, well, let's do a quick word breakdown on that. Word breakdown for tenosynovitis. So tenot or tenon means sinew or tendon. O joined is just a joining vowel. Synovitis, more at tendon. Huh. More at tendon. Okay. Word breakdown of sino. Synovi. No, word breakdown. Synovi. Synovial, pertaining to the synovial fluid. That doesn't help you very much because we didn't go over those structures. Okay. Onward. A new client comes to a clinic with a diagnosis of ALS. ALS is also Lou Gehrig's disease, right? Of the following options, which is most appropriate for this client? General constitutional methods, treatment with physician supervision, treatment without physician supervision, or adjusting the amount of pressure as the disease progresses. So this is one of those diseases you definitely should have a physician's supervision. So, oh no, I guess you don't need. Wait, what's the question? Which is not appropriate? Not appropriate. Yeah, not appropriate. Yeah, not appropriate. Treatment without physician supervision is not appropriate. It is appropriate. General constitutional methods are appropriate. Treatment with physician supervision is appropriate. Adjusting the amount of pressure as the disease progresses is appropriate. Okay. ALS, also known as Lou Gehrig's disease, is a complex progressive neurological condition. It starts with the central nervous system and eventually involves motor neurons and atrophy of muscles, often resulting in death. Massage is indicated for this condition, but it must be done under physician supervision, secondary to its complex and changing nature. General constitutional methods are indicated for these clients. This disease is progressive, which means it changes over time, and so is appropriate to adjust the pressure and intensity of the massage as symptoms worsen. I'm just going to put that one in red because I think most of us were lost on that. And I didn't, even though I knew the pathology, I didn't read the question correctly. So, okay. An athlete is running and suddenly steps on an unexpected rock and rolls her ankle, which results in immediate pain. What system does this predominantly activate? Is it the enteric nervous system? Enteric means gut. Is it the parasympathetic nervous system? Parasympathetic means safety, like parachute. Sympathetic nervous system or the central nervous system?
Central nervous system.
Sympathetic.
Well, if someone experiences unexpected,
No, unexpected. Okay.
what's that?
Mhm.
It's the answer is sympathetic.
Mhm.
Sympathetic. Sudden acute pain activates the fight or flight system. Increased heart rate, increased respiration, decreased gastric secretion, pupil dilation, among others. A basketball player recently has a massage recently had a massage with coconut scented oil. Shortly afterward, he notices redness, itching, and some blisters on his legs, which he has never experienced before. What is the most likely cause? Contact dermatitis, atopic dermatitis, psoriasis, or urticaria?
Atopic dermatitis.
Can I hear from somebody else?
Is that or contact?
The answer is contact.
Yeah.
Contact. Okay, let's put that one in red, so you guys can take a look. Okay, just a few more minutes. When working with a client, a massage therapist notices red streaks along one leg. What's going on with this? Yeah, the client also has noted pain along this leg recently following a spider bite in the same leg. The therapist continues with the treatment as usual while taking care to avoid the involved area. What should the therapist have done differently? Worn gloves instructed the client to call his physician after the session, stopped the massage, spoken with the client about the dangers of these symptoms and referred him to a physician, used a hypoallergenic laundry detergent to wash the sheets before the session. The answer is stopped the massage, spoken with the client about the dangers of these symptoms and referred him to a physician. Which of the following is an example of a respiratory infection? Is that asthma, pneumonia, anemia, or phlebitis? Respiratory infection.
Pneumonia.
Did someone say anemia? No, not anemia. Remember, A means not, and then emia refers to blood, so not enough blood.
Is it asthma?
And
It's not asthma because it says the question is respiratory infection.
B.
Pneumonia, that's right, and
Pneumonia.
phlebitis, yes, and the last choice, phlebitis, is inflammation of a blood vessel. So definitely one you guys want to look at. Right. Again, the choices were asthma, pneumonia, anemia, and phlebitis. Fill in the blank. A therapist client is on a blood clotting medication. As a result, the therapist should what? Perform the massage as usual. Always perform a deep tissue massage for this client. Provide deep pressure and aggressive techniques to break up tissue restrictions. Avoid methods that may cause bruising, including compression, friction, percussion, and skin rolling.
Avoid methods that may cause bruising include compression, friction, percussions, and skin rolling.
Yes, correct. A client has weak bones that are prone to fracture. Which of the following conditions does she most likely have? Thrombosis, osteoporosis, arteriosclerosis, or torticollis?
B.
Osteoporosis. Osteoporosis, correct. A regular client comes in for their first monthly massage. When they arrive, they say, I'm so excited for this. I have the flu and I've had a fever for days. Okay, so obviously proceed with the massage or reschedule the session. It's reschedule the session. Yeah. During an intake assessment, a client complains of spinning, nausea, dizzying sensation when he rolls from lying on his left side to his right side. What condition may he have? Parkinson's disease, whiplash, vertigo, or thoracic outlet syndrome?
Vertigo.
Or thoracic. Vertigo?
Vertigo. It's vertigo, yes. Thoracic outlet syndrome is the impingement of the brachial plexus by soft tissue structures. Results in pain, sometimes weakness of the arms and hands. Okay, last one. Fill in the blank. A massage therapist is employed by a doctor. Whenever the doctor assigns the therapist a new client, the two colleagues schedule a meeting to discuss the client's health history in advance of the massage. In the course of this discussion, the doctor tells the therapist about the patient's what, which is the expected outcome of the patient's illness, the symptoms, the diagnosis, the prognosis, or the syndrome. The answer is prognosis. So prognosis means gnosis means knowing, pro means before. So you know what's going to happen before it happens, right? You know the outcome before you get to the outcome, right? Dia means across. So you know across all the symptoms, looking across all the knowledge and all the presenting symptoms, you know the cause, right? A syndrome is a collection of symptoms, and a symptom itself is like some of what a symptom is what the person complains of or what they suffer from. Okay, that's it for today. I'm gonna see you tomorrow. And tomorrow's gonna be our last class. Thank you very much for your patience and for hanging in there. And I know these classes can be exhausting, and I appreciate you guys letting me reschedule without incident. This is a makeup for class number 7. Tomorrow's gonna be a makeup for class number 8. So we'll see you guys tomorrow. All right. Take care.
You too.
All right, thank you.
Thank you.